going to introduce myself. Hi, my name is Tondi. I'm going to be your nurse today. I'm going to be performing just a quick little video assessment on you. And what's your name?
Janet Blake.
Okay, Mrs. Blake, it's so nice to meet you.
Thank you, Tondi.
So you're welcome to ask questions at any point during the assessment, and everything that you ask and say will be confidential in the assessment. Okay. So the first thing I'm going to do is sanitize my hands, and we do that to prevent any cross-contamination and infection to patients. So we're just going to go ahead and use some sanitizer. And can you tell me what today is?
Sure. Today is Saturday, October the 5th.
And where are we?
In Sherwood, Arkansas.
Okay. So Miss Flake is alert, oriented, and awake. So alert, oriented, and awake times 3. And she is also aware to person. She knows who she is. Can you also tell me, I'm going to say 4 words for you, and it's just to assess your memory at the beginning of the exam and at the end. So the words are going to be yellow, chair, ball, and pencil.
Okay.
So we'll just say it one more time.
Yellow, chair,
ball, and pencil. Okay. So before we started the exam, I took Miss Janet's vital signs, and her vital signs today are she's got a heart rate of 85, her blood pressure is 117/80, and respirations were non-labored and they were at a 12, and her temperature was 98.7 taken orally, so everything was within defined limits, okay? So the next thing that we're going to do is we're going to ask about your pain level. Do you have any pain today?
Not real.
Not real? No pain that you feel today. Okay. So now we're going to go ahead and assess your head. And so for me to do that, I am going to have to touch your hair. I'm not going to mess it up. But I can look at your face and your head and tell that you're a normal cephalic, that your facial features are, in fact, even, and your hair is evenly distributed throughout your hair. I'm just going to take a look at that evenly distributed hair, and it's blonde in color. She's got no scabs or lesions or parasites on her hair. It's just nicely moisturized hair. And as far as your face goes, your eyes are in your upper third part of your face, your nose is exactly midline, and your mouth is in the lower third part of your face, so you're perfectly symmetrical. And now what we're going to do is test your cranial nerve number 5, and how we're going to do that is that's your trigeminal nerve. So cranial nerve number 5 is trigeminal, and we will close your eyes, and I'm going to just lightly touch parts of your face, and can you tell me where I'm touching?
Chin. Cheek. Left cheek.
Okay, so trigeminal nerve, cranial nerve number 5 is intact. She could sense where I was touching with her eyes closed. The next thing that we're going to do is we are going to see if you're able to clench your jaw for me, and I'm just going to palpate that with my hand, so if you could clench your jaw. Okay, and you can release, and you can tell that both sides are equally strong when she clenches her jaw. And then the next thing we want to do is test your cranial nerve number 7, and what we're going to do is have you close your eyes, and you're going to feel me trying to pull your eyes open, but you're not going to let me do that, okay? All right. So cranial nerve number 7 is intact. I was unable to open the patient's eyes. So next we're going to do an eye assessment. So Miss Flake, you typically wear glasses every day.
I do.
Okay. So I'm just going to take a look at your eyes. If we could remove your glasses for one moment. Okay. So we're going to note that Miss Flake's eyes are bilaterally free of any drainage. There's no fluid in her eyes. They're both blue in color. Miss Flake, you can put your glasses back on. Let's see. and I see that your eyelashes are facing outwards and that you have eyebrows and they're both there and they're smooth. There's no lesions or scaling there, and I can tell that on palpation. Let's see. And yes, your eyelashes are everted. That's the word I was looking for. And at this point, if we were going to be checking your vision, we would be checking cranial nerve number 2, which is the optic nerve. We would use the Snellen eye chart, and what we would have you do is cover one eye with your hand or with an index card, and you would read at a distance of 20 feet. And we would do that with both eyes, with and without the glasses. And then also to assess for color blindness or color perception rather, we would use the Ishihara test to have you look at bubbles which are different colors to be able to tell whether or not your eyes can discriminate color. Do you have any pain or anything with your eyes? Okay.
None.
Okay. So next, we're going to look at cranial nerves number 3, 4, and 6. And 3 is ocular motor. Cranial nerve number 4 is trochlear, and cranial nerve number 6 is abducens. And we're going to use a pen light and have you follow it so that we can see if your extraocular eye movements are intact, okay? So I'm not going to turn this on, I'm just going to have you follow me. Okay, so her extraocular movements are intact. She's able to move her eyes at all degrees with prompting. And then we're going to take a look at your eye next. And I'm just going to shine this light not too brightly into your eye. Okay.
You want the glasses off?
Yes, I think if we take the glasses off, we can probably see better. Let's see. So both of her pupils are black. They are accommodating to light. They are equal, round, and reactive. So I would say Perla is intact. And then if I could have you look just at a distance, I'm going to take a look at what your eyes look like at a distance. So if you'll look at that picture on the far wall, and her eyes have accommodation, and they are adjusting to focus on something at a distance. And they also have the consensual reflex upon examination with light. Okay. Thank you, Ms. Flake. You can put your glasses back on if that'll help you see better. So now we're going to take a look at your ears. And with your ears, first of all, I'm going to go ahead and touch your ears if that's okay. So we're going to note that Mrs. Flake has bilateral ear piercings. Both of her ears are symmetrical. They are at the ear tips are palpable at the palabral fissure. The skin is uniform with her head and neck. There's no draining or any tenderness on palpation. Are you feeling any tenderness, Ms. Flake, as I touch your ears?
No.
No tenderness at the tragus?
No.
Or at the auricular area?
No.
Perfect. Not seeing any tenderness on either side of her ears. And also none at the auricle as well. I'm just going to touch the outside of your ears. No tenderness there either?
No.
Okay. And then what I'm going to have you do now is let me just take a look at your ear. I'm going to take a look with this light. Okay. Don't see any drainage or fluid or any extra cerumen in that ear. Going to check the same thing over here. Don't see any extra drainage or fluid or cerumen at the ear. I can tell on palpation when I try to lift both ears that they're both elastic and flexible and they recoil immediately. Okay, and now what we're going to do is test your cranial nerve number 7, which is your vestibular cochlear nerve. So what I'm going to do is have you cover one ear, and then I'm going to stand over here, and if you'll tell me, I'm going to say a 2-syllable word, and if you can tell me what that word is.
I'm sorry, I didn't hear you.
Toothpaste.
Toothpaste.
Okay. And I'm going to come on the other side and we'll do the same thing again. So if you'll cover this ear, and I'm going to stand over here. Shopping bag.
Shopping bag.
Okay, so cranial nerve number 7 is intact. Patient was able to hear on both sides a word whispered on the opposite side while that ear was covered. Okay, so then if I had an otoscope at this point, I would be looking in the ear for a pearly gray tympanic a tympanic membrane bilaterally, making sure that there's no drainage or fluid collected within the inner ear, and also I would be able to see the small bones of the ear, including the incus, the stapes, and the malleolus. Okay, next we're going to take a look at your nose. So Ms. Flake's nose is midline, there's no deviation, don't see any lesions or drainage. The skin on the nose is intact, there's no swelling or edema. Do you have any pain in your nose, Ms. Flake?
No pain.
Okay. So as far as the nose goes, we're going to be testing cranial nerve number 1, that's the olfactory nerve, and we're going to have you smell something, and if you'll depress one of your nostrils for me, and then just kind of give me a sense of what you smell, okay?
Mm-hmm.
If you'll just depress one nostril and close your eyes for me, we'll have you just take a whiff of this and tell me if you smell something.
Smells kind of alcoholish.
Okay, perfect. And so we would do that bilaterally to test that she has intact nasal functioning with olfactory cranial nerve 1. Okay. The next thing that we're going to do, now that we've taken a look at your nose, is we're going to look at your mouth. So Ms. Flake's lips are symmetrical. They're moist and pink. No lesions, cracking, or sores on the lips. I also want to test your cranial nerve number 9 and cranial nerve number 10, the glossopharyngeal nerve and vagus nerve. So what I'm going to have you do, Ms. Flake, if you don't mind, is just, we're going to have you open your mouth. Actually, I'll put gloves on for this portion, so I'm going to sanitize my hands again. If you'll just open your mouth and say ah and stick your tongue out, okay? So Ms. Flake's buccal mucosa is pink. Her uvula it is midline, and it is, you can close your mouth. Uvula is midline, and it does move with sound that comes out of Ms. Flake's mouth. She has no lesions in her mouth. The buccal mucosa, if I can look again. Okay, the buccal mucosa is uniformly pink. Her hard and soft palate are continuous, and the white palate is without lesions, and it's hard and with transverse rugae. So her tonsils, do you have your tonsils?
No.
Let's take a look. We'll open. Ms. Flake does not have her tonsils. At what age did you have those removed?
When I was 5.
Okay, so Ms. Flake doesn't have any tonsils to assess because they're no longer there. They're removed surgically at age 5. Okay. So the tongue is pink on the dorsal surface. There are some fissures there. On the ventral surface, if you'll open again, ma'am, so I can look under your tongue, it is glistening with veins. She has a full set of adult teeth with some restorative work, but no dentures or any kind of other devices in her mouth. Okay. Thank you, Ms. Flake, for letting us look in your mouth. So the next thing that we're going to take a look at is the cranial nerve number 12, the hypoglossal cranial nerve. And if you'll just stick your tongue all the way out, we'll take a look, and there it is. So her hypoglossal cranial nerve is intact. She's able to stick her tongue out with no problem. Okay, so next now we're going to assess the skin, and we'll sanitize again since we removed those gloves. The neck, okay, so her neck is free of lesions. There's no edema or swelling that I can feel upon palpation. The skin is continuous with the skin on her face and her chin, and also the upper part of her chest. And I don't notice any scars. Now, Miss Flake, would you mind just showing me the range of motion you have with your neck? So first we'll have you tilt your head backwards, and then tilt your head forward. And then if you could tilt your head to the left, and then over to the right. So, Miss Flake, is it painful for you at all, any of those motions? Okay, so Miss Flake has a full range of motion of her neck. She's able to move it in all directions. And then while you're moving your neck, actually, I'm going to palpate for any crepitus in your neck. So if you just want to turn your neck to the left and then over to the right. So there is no audible or palpable crepitus in Miss Flake's neck, and she says she has no pain with range of motion. And now the next thing we're going to do here is we're going to test your accessory nerve, and that's cranial nerve 11. And the way we're going to test that is I'm going to put my hand on your shoulders, and I'm going to push down, and you just push up. Okay? So Mrs. Flake's cranial nerve number 11, accessory nerve, is intact. I'm pushing down on her shoulders, and bilaterally her trapezius and sternocleidomastoid muscles are strong, and she's able to resist that force, and so that nerve is intact. Okay, so now we're going to go ahead and palpate your lymph nodes, and the first thing I'm going to do is I'm going to palpate behind your head the occipital lymph nodes, none present there, the preauricular, postauricular, superficial cervical, tonsillar, submandibular, and periauricular lymph nodes. And do you have any pain or tenderness in any of the areas that I palpated?
No, I do not.
Okay. Miss Flake doesn't have any palpable lymph nodes in any of those neck regions, and she has no pain to report either upon palpation. Okay. So then the next thing that we want to do is I'm going to want to assess your post-cervical deep lymph nodes, and I have to do those one at a time. So if you'll go ahead and just tilt your head that way, I'm just going to kind of, oh, actually, I'm sorry, turn your head that way. I'm going to palpate there. And if you'll turn your head the other direction, I'm going to palpate there. And we're not feeling any lymph nodes there at all, and no pain either, okay? So then the next thing we want to do is assess your carotid artery, and we're going to do this one at a time. And so for us to do that, I'm going to have to use my stethoscope. And if you will, okay, just hold your breath, and I'm just going to listen there. Okay, you can breathe. And if you'll hold your breath again. And you can breathe. All right, upon auscultation of bilateral carotid arteries, I didn't hear any bruits, and a bruit would be indicative of stenosis of the carotid artery, and she did not have that, so that was good. Okay, so then I'm also going to go ahead and palpate those carotid arteries one at a time. Okay, I'm going to come over to the other side. Okay, they were palpable bilaterally with normal rhythm. Okay, so the next thing that we're going to do is take a look at your thorax. And in order for us to do that, first of all, I'm just going to note that Miss Janet's thorax area is uniformly colored. The skin is continuous with her neck and down to both of her bilateral arms. There are no bruises, lesions, and I'm going to palpate and ask, is there any tenderness?
No, none.
Touching? Okay.
No, I'm good.
Okay. And she has no any kind of bumps or bruises or lesions on her back that I can feel upon palpation. The next thing I want to do is I want to take a look at the diameter of her anterior to posterior chest wall, and that should be a ratio of 1 to 2, and it appears that she has that. Okay. The next thing that I'm going to do is I'm going to place my hands on your back, and I'm going to have you say the word 99, and I'm going to palpate and feel for mitis. So could you say the word 99?
99. 99. 99.
Okay, so with every audible word of 99, I could feel the vibration in the posterior portion of her back. The next thing that we want to do is I'm going to go ahead and listen to you to hear your breath sounds in the back portion of your back. So I'm just going to, okay. And if you could kind of turn your body so that you're sideways in the chair, I'm going to listen here at 10 different areas. Breathe in for me. All right, so we've got vesicular lung sounds in the peripheral lung fields. Now, Ms. Blake, I'm going to listen to the lateral sides of your chest, if you'll allow me to do that. So I'm going to just kind of get my stethoscope right kind of under your arm, if you'll just breathe in and out for me. I'm going to come back over here and listen in 2 more areas. Okay, breath sounds clear and present there. And now we're going to listen to your anterior chest. Okay, breath sounds are clear in all fields, no adventitious sounds. And so now the last part of this assessment now is going to be that we're going to assess for skin turgor. I'm just going to gently pinch your skin, and she's got good skin return. There's no tenting, and I don't see any intercostal retractions, which would indicate labored breathing. So now for the last portion, which we're not going to do, we're just going to verbalize. If we had to do a breast assessment, first of all, we would have the patient sitting, and they would be in 3 separate positions: hands overhead, hands on hips, and also leaning forward. What we're going to be looking for are any retractions, edema, possible masses, lumps, and we're going to also make sure that the areola are darker than any other part of the breast. that the nipples are everted bilaterally. We also want to look for striae and increased vascularization. And upon palpation, there are 3 methods that you can use. You can use a circular motion. You can use a motion that's vertical, that starts from the axilla and works its way down the breast tissue. Or you could do like the spokes of a wheel and just go vertically up and out in the direction coming out from the areola. And then lastly, you also want to make sure that you assess the lymph nodes in the axillary area. And so you're going to go up those lymph nodes and palpate there in the central, posterior, anterior, and lateral axillary nodes. And then finally, you would palpate and squeeze the nipple to assess for discharge. And that would be it. Thank you.